Hello everyone. In today's video we are going to study about type 1 diabetes mellitus. Okay. So as all of you might be knowing, diabetes is a chronic metabolic disorder of carbohydrate metabolism associated with absolute or relative deficiency of insulin, resulting in underutilization of the glucose by tissues, which is presentable in the form of hyperglycemia. So this is the basic definition of diabetes mellitus. So basically, we have classified diabetes into two groups, that is type 1 diabetes mellitus and type 2 diabetes mellitus. So today I will be talking about type 1 diabetes mellitus under following headings. So we will study about introduction, that is where we will see the major key points related to type 1 diabetes. Then I will be talking about pathogenesis part. So why type 1 diabetes happens, what is the basis of type 1 diabetes, that will be covered under pathogenesis part. Then I will be talking about sign and symptoms of type 1 diabetes. So how you are going to identify diabetes, what are the major signs and symptoms which we see in type 1 diabetes mellitus patient. And the fourth one, I will be going to talk about metabolic changes seen in type 1 diabetes mellitus and its basis. What is the biochemical basis of these metabolic changes seen in type 1 diabetes? So these are the major heading under which I am going to talk about type 1 diabetes. So starting with introduction part. So as all of you might be knowing, type 1 diabetes mellitus is associated with absolute deficiency of insulin due to autoimmune destruction of the insulin secreting beta cell of islet of Langerhans. So there is absolute deficiency of insulin. So that is the first key point you should remember. So there is absolute deficiency of insulin, and in most of the cases there is autoimmune attack on the beta cell of the pancreas. So that will decrease the insulin amount to almost nil. Okay, so there is absolute deficiency. It is seen in this type 1 diabetes mellitus, it is seen in children. Generally it is seen in children and adolescent age group. So most of the patients of type 1 diabetes are below 30 years of age. Okay, so it has been seen that almost 75% of the patients who develop diabetes are below 30 years of age, and mostly it is seen in children and adolescent age group population. Okay, and remember, this type 1 diabetes mellitus is more severe compared to type 2 diabetes mellitus, because chances of acute complications are higher, like development of diabetic ketoacidosis or hypoglycemia in these patients are very high compared to type 2 diabetes mellitus, as well as the chronic complication associated with type 1 diabetes mellitus is more severe and is more frequently seen. If you compare it with type 2 diabetes mellitus, so the chronic complication of type 1 diabetes mellitus is more frequent. So there could be diabetic retinopathy, diabetic nephropathy, or peripheral neuropathy, or gangrene which can be seen. So these are the chronic complications associated with type 1 diabetes mellitus. So coming to the next part, that is classification. There is small classification of type 1 diabetes mellitus. So there are two types here. In type 1 diabetes mellitus there are two types. That is type 1A and type 1B. Type 1A is immune mediated. So there is immune mediated damage to the beta cell of the pancreas. And type 1B, which is very rare, that is idiopathic. Means there is no known cause of type 1B. diabetes mellitus. So most of the cases of type 1 diabetes mellitus belong to this type 1A category. Okay, so I will be talking about type 1A in detail. Okay, so this is the classification of type 1 diabetes mellitus. So there are basically two types, type 1A and type 1B. Type 1A is immune mediated, so there is basically that is associated with autoimmune attack on the insulin secreting beta cell of islet of Langerhans, and type 1B we don't know the exact cause of that. Okay, so these are the two types of type 1 diabetes mellitus, type 1A and type 1B. So coming to the pathogenesis part. So pathogenesis is generally associated with, coming to pathogenesis, where this is pathogenesis part is associated with insulitis. Insulitis is nothing but infiltration of that insulin secreting beta cell of islet of Langerhans by T cells. Okay, so during this insulitis process, this due to certain factors, this immune system of ours turn abnormal, and the immune cell which is responsible for attacking the beta cell of the pancreas, that is its own cell, that is T cells, and this immune attack or abnormality of this our immune system is mainly triggered by certain factors. That could be due to certain genetic factor, that could be due to exposure to certain viruses, like mumps viruses or rubella viruses, or exposure to certain chemicals, or like even cow milk exposure in some person can trigger, or it can make our immune system abnormal, where that immune system of ours is not able to differentiate between self and non-self. So obviously there will be infiltration of that beta cell by T lymphocyte, and T lymphocyte is going to destroy the insulin secreting beta cell of islet of Langerhans, and that will that damage when there is 85 to 90% loss of beta cell mass, that is caused by infiltration of that T lymphocyte. So sign and symptoms of type 1 diabetes mellitus appears. Okay, so when this 85 to 90% mass of that beta cell or the cell mass of that beta cell is lost, so in that condition, of course, insulin secreting capacity of pancreas will go down, and no longer that insulin will be able to regulate blood glucose level, and that will cause hyperglycemia, and the hyperglycemia induced sign and symptoms will start appearing. So this is the pathogenesis part you should remember. And how somebody can know if there is autoimmune involvement associated with type 1 diabetes is there or not. So we can check, or we can estimate certain autoimmune markers which are present in the patient of type 1A diabetes mellitus, and these markers are present before the onset of sign and symptoms. So before the onset of sign and symptom of type 1 diabetes, these markers or autoimmune markers are present in the serum of the individual. So what are those autoimmune markers? So now we will look into the autoimmune markers of type 1A diabetes mellitus. So there is presence of there is a presence of cytoplasmic, there is a presence of islet cell cytoplasmic antibodies in the serum of those people who are prone to develop type 1 diabetes mellitus. Then there is a presence of insulin auto antibodies in serum. There could be presence of antibody to GAD Z65, that is isoform of enzyme glutamic acid decarboxylase. There could also be the presence of IA2A and IA2-beta in the serum of the individual, which are prone to develop type 1 diabetes mellitus. So these all are the autoimmune markers of type 1A diabetes mellitus. So there could be presence of islet cell cytoplasmic antibodies. We can also see in serum insulin auto antibodies. There could be also presence of antibody to glutamic acid decarboxylase 65, that is an isoform of the enzyme called glutamic acid decarboxylase. And there could also be the presence of IA2A and IA2-beta, that is the antibody which is against that tyrosine phosphatase enzyme. So these are the major autoimmune markers of type 1 diabetes mellitus. Now coming to the sign and symptoms. So once there is a 80 to 90% loss of beta cell mass, so there will be sudden appearance of the symptom. Okay, there will be sudden appearance of sign and symptoms of type 1 diabetes. So the first sign and symptoms what we see is that is characterized by 3 P's. Okay, the first P is polyuria. The second P is polydipsia. The third P is polyphagia. So you must be aware of these terms. Polyuria means increased urinary output, and that will be reflected in the form of increased frequency of urination. Polydipsia means increased thirst, okay, and the polyphagia means increased hunger. So these are the 3 medical terms or the 3 classical signs and symptoms which we associate with type 1 diabetes mellitus. So why we see polyuria, polydipsia and polyphagia? These are the classical sign and symptoms of type 1 diabetes mellitus. So and remember the differential, the main point here is the symptom will be abrupt. The symptom appearance will be very abrupt. It will be very sudden and it will be very severe, okay, and very vivid. So why there is polyuria? Polyuria means there will be increased urine output, there will be increased frequency of urination, and that happens why? Because you know that in type 1 diabetes mellitus there is absolute deficiency of insulin. Insulin is absent, totally absent. So what will happen? So the main function of insulin is to regulate blood glucose level. It is a hypoglycemic hormone, so it reduces the blood glucose level. So since insulin level is totally absent, so there will be hyperglycemia, and this hyperglycemia will cause what? That will elevate the blood glucose level because of the decreased peripheral utilization of glucose by different tissues. So once that blood glucose level exceeds 180 or greater than 180 mg per dl, once that blood glucose level become equal to or greater than 180 mg per dl, so this filtered glucose won't be able to get reabsorbed fully by renal tubules. Okay, so generally there is one transporter present in proximal convoluted tubule, that name is sodium dependent glucose transporter 2, SGLT2, sodium dependent glucose transporter 2. So in normal individual, whatever glucose which is filtered by kidney is reabsorbed with the help of this SGLT2. But what happens if there is a type 1 diabetes? Obviously the blood glucose level will be on the higher side, and if it exceeds or become equal to 180 mg per dl, that is the renal threshold for glucose, so this transporter called sodium dependent glucose transporter, which is present in the proximal convoluted tubule, will start getting saturated. So it won't be able to reabsorb all the glucose, and this glucose will start spilling into urine, and that is called glucosuria. And this glucose, as you know, glucose is an osmotically active substance. Along with eat, it also pulls water. Okay, so along with that glucose, water excretion rate will also increase, and glucose will pull more and more amount of water, and that will result in polyuria. Okay, that is increased urine output. And if you see in diabetic patient, and the urine output is generally greater than 2 liter per day. Normal urine output is around 1 to 1.5 liter per day, but in case of diabetes, the urine output become more than 2 liters per day. So that is the cause of polyuria. Okay, so glucose along with it also takes water, or it pulls water. That is called osmotic diuresis. That term which we use for this glucose pulling effect, and by which glucose pulls water along with it, that is called osmotic diuresis. So this is the cause of polyuria. Why there is polydipsia? Since there is excess water loss through urine, obviously your plasma volume will get down. Our plasma volume will decrease due to polyuria, that is increased loss of water in urine. So there will be dehydration due to decreased plasma volume. So when the plasma volume is getting decreased, so we need more water, and in order to compensate for the loss of water through urine, our thirst center, which is present in the brain, will get stimulated, and we will have feeling of having more water. We will feel like our throat will become dry, and we will feel like having more water, and that's why there will be increased thirst. So that is called polydipsia. Why there is polyphagia? Means increased hunger. Obviously, if there is no insulin, so if insulin is absent, so our tissues are not able to use glucose as a source of energy, because insulin is required. Insulin plays a very important role in utilization of glucose by peripheral tissue. So these peripheral tissues are not able to utilize glucose, like maybe skeletal muscle or cardiac tissue or white adipose tissue. They are not able to perform glycolysis. Even liver is not able to utilize glucose properly. So what will happen? Obviously, our tissues are deprived of glucose. So in order to compensate for that, our hunger center inside brain will get stimulated, and there will be sensation or urge to have more amount of food, and that is why we see polyphagia. So that is the major classical signs and symptoms of type 1 diabetes, that is polyuria, polydipsia and polyphagia. And apart from that, there could be sudden rapid weight loss due to increased lipolysis, weight loss. There could be repeated infection and delayed wound healing. There could be dry skin due to dehydration, okay, and there will be reduced skin turgor. So all those signs and symptoms can be seen in case of type 1 diabetes mellitus. So the only point here is the sign and symptom are very rapid and very acute, means it will appear suddenly, and that will be very vivid, very clear. So this is all about signs and symptoms of diabetes mellitus. Coming to the metabolic changes which we see. Metabolic changes seen in type 1 diabetes mellitus is hyperglycemia. Hyperglycemia, why there is hyperglycemia? Because that insulin is absent. So there will be decreased peripheral utilization of glucose by tissues. So glucose won't be able to go from blood into tissues, inside tissues where they can be utilized for energy purpose. So obviously that will increase blood glucose level, as well as there will be increased hepatic gluconeogenesis. Okay, and this liver will synthesize more amount of glucose, and that glucose from liver will be spilled into blood. That will further add on to hyperglycemia. So these are the two main cause of hyperglycemia which is seen in type 1 diabetes mellitus patient. The second thing which we see, and that is an acute complication that could be seen in the form of acute complication, that is ketosis. Okay, so there is a acute life-threatening condition associated with type 1 diabetes mellitus, that is called diabetic ketoacidosis, characterized by there is decrease in pH of plasma, there could be decrease in bicarbonate level, there could be a fruity odor smell in person's breath, there could be deep sigh breathing pattern, that is called Kussmaul's respiration, or appearance of glucose in urine in very high amount along with ketone body, and that ketone body will give fruity odor to urine. So these are the signs of diabetic ketoacidosis, and this is acute complication of type 1 diabetes mellitus. So why there is ketosis? Okay, why there is an increased formation of ketone bodies in case of type 1 diabetes? So you know that if insulin is low or insulin is absent in this case of type 1 diabetes, so obviously glucagon level will be on higher side. This glucagon will stimulate one enzyme called hormone sensitive lipase, and this hormone sensitive lipase, it's going to break that triacylglycerol present inside adipose tissue to free fatty acid and glycerol, and these free fatty acid will go with the help of albumin, it will enter into circulation and it will go inside liver, and inside liver this free fatty acid inside liver will be broken down into acetyl coenzyme A, and this acetyl coenzyme A influx will be very high, and there will be increased level of acetyl CoA can lead to conversion, or this acetyl CoA, if it is available in high amount, that will be used for the production of ketone bodies inside liver. So liver will synthesize more amount of ketone body, and these ketone bodies generally ketone body level is very less in normal individual. The normal value of ketone bodies is around 1 mg per dl. So there will be excess formation of ketone bodies by liver due to increased availability of acetyl coenzyme A, and these ketone bodies won't be able to get utilized by peripheral tissues, so resulting in what? Ketonemia, that is increased level of ketone bodies in blood. So there will be ketonemia, and this ketonemia, once that renal threshold of ketone bodies is 3 mg per dl. So once the ketone body level in blood increases, after a while, once it exceeds its renal threshold, that is around 3 mg per dl, it will start appearing in urine. So the appearance of ketone bodies in urine is called ketonuria. Okay, so ketonemia plus ketonuria combined together is called ketosis. Okay, so ketonemia plus ketonuria together is called ketosis, and this excess formation of ketone bodies can lead to a life-threatening complication called diabetic ketoacidosis. Why that happens? Because that ketone bodies are acids. They secrete H plus ion, and this H plus ion can decrease the pH of our blood. Why? Because this H plus ion will decrease the bicarbonate, that is the main plasma buffer which is present, and this bicarbonate level will go down, pH will also go down, and that will cause a complication, severe complication, that is a life-threatening complication, that is called diabetic ketoacidosis. So this is why we see ketosis, and that will be reflected in the form of diabetic ketoacidosis in type 1 diabetes mellitus patient. Apart from that, there could be hyperlipidemia. So as I told you, since this type 1 diabetes is highly catabolic state, where there is an increased flow of this free fatty acid inside liver, and this free fatty acid can also bind with glycerol to form what? Triacylglycerol, and this triacylglycerol inside liver, it is packed in one lipoprotein called VLDL. Okay, so this triacylglycerol is packed into VLDL lipoprotein, and this, since in diabetic individuals, since insulin is totally absent, this VLDL metabolism will get hampered. Why? Because this VLDL metabolism require one important enzyme called lipoprotein lipase. So lipoprotein lipase activity will be less due to
absolute deficiency of insulin. So what will happen? VLDL will accumulate in blood, VLDL level in blood will increase, as well as chylomicrons, which is coming from intestine, which is major carrier of triacylglycerol, dietary triacylglycerol, that level will also increase, and ultimately that can cause what? Increased level of triacylglycerol in blood. So hyperlipidemia is also one of the metabolic changes which we see in type 1 diabetes. So these are the three major changes, metabolic changes which we see. One is hyperglycemia due to decreased peripheral utilization of glucose by peripheral tissues, or due to increased hepatic gluconeogenesis. There could be ketosis due to increased influx of this free fatty acid and increased formation of acetyl coenzyme A, which will go into ketone body synthesis. And there could be hyperlipidemia due to accumulation of VLDL and chylomicron inside blood due to deficiency or decreased function of one enzyme which require insulin for its activation, that is lipoprotein lipase, and resulting in hypertriacylglycerolemia. So these are the major findings, and of course there could be increased level of cholesterol in blood, and all these factors can combined together can cause both acute as well as chronic complication of type 1 diabetes. So I hope this video was useful to you, and especially for MBBS student and for paramedics and nursing students, that will be very helpful. And thank you for joining.